mean, Dada. I was already in England and studying, you see, so it's different.
Doctor, let me ask you, the dividing line between experience in your profession and sophistication in terms of the technology at your disposal.
You see, in medicine, you do a technology. For example, somebody had a cancer right of the breast. Technology will be in America or in England. The women, because of education, because they have a small lump, they come to the hospital. So you do a mammogram so that you can pick it up much earlier and you operate. Then they have a radiotherapy. We don't have a radiotherapy, which is very essential in this country. Second, mammogram, we don't have a machine. So those are essential, but ultimately those are called technological aspect. But ultimately what happens? After doing all the tests, whether it is sophisticated or unsophisticated, patient has to come to surgery. And you do surgery according to not only experience, according to what is right for this country. I'll give you an example of cancer of the breast. Women come very, very late. I've got about 1,000 pictures, all pictures before operation, after operation and all, right? I review them. We don't have a radiotherapy. So we depend on chemotherapy, that is called drugs, which give post-operatively. Fortunately, the year I came, they had a lot of gift and there were drugs available. And subsequently, now we're trying to get. So most of them, they get what they call a first-line treatment in chemotherapy. Second-line treatment is very, very expensive. Nobody can afford, right? So this is what it is. What this country needs is a radiotherapy post-operatively for cancer of the breast. You need what you call mammogram. That's a machine which will pick up or one of the instruments which is in sophisticated country. These are the two things they have. What is extra than what Gambia has. And chemotherapy. All right, the first line of treatment of chemotherapy, all the drugs are available here. I don't know how, but it is always buying. Sometimes majority are coming as a gift, right? So we manage. Ultimate result, those who are having a fourth stage extensive carcinoma. I have people going around without any metastasis, at least 4 or 5 patients, right? They subsequently went to England, got total scan, and there was no metastasis at all. So this is when you do that type of surgery, you feel satisfaction, right? It's nothing more than that, but there is too much workload, and you got to have those type of things. It's not the technology, it's the most important experience. You travel more and more. You operate the same thing what you would operate in England or Taiwan or any other country, all right? So this is what it is, right?
You mentioned the medical department of the University of the Gambia.
Yes.
How is this contributing to the national health sector?
These are called different departments. Like Professor Young is the head of the internal medicine. I was a head for up till last year, head for the surgical department, because we got a local Gambian who qualified recently 2 years back. We decided that he should be a head of the department, Dr. Samate, all right? So that if the local doctor or junior who are promoted or who are encouraged to do, so that they can expand, or in their own way they can expand surgical department. Same thing, Dr. Nyang could have been a well-off anywhere in the world, but he decided to come here. That everybody had their own priority, why they come here. Like I said, if it was Uganda, same like before. I was offered, I went for a holiday, and I said no, you see.
Doctor, if I may ask you, how would you summarize the health sector of the Gambia at present?
All right. Pediatrics at the moment, we have good doctor from MRC. That's a local Gambian, right? So the consultant that normally in pediatrics, the consultant, they see the children. So they treat medically what is like cough, cold, pneumonia, and all the other conditions. When it comes to surgical aspect, say the child needs surgery, the children are very, very important, because you cannot just put a knife and say, do, right? You have to have experience with children's surgery. I was fortunate enough to work in Mulago with somebody very, very eminent in the world. Then I worked in pediatric surgery in England. So I was fortunate enough to deal with kids, and all the other countries have been doing both surgery, pediatrics, thoracic, like that, you see. So I would say that the girl is very fortunate, right? Was seen by somebody from pediatric side and from surgical side who are more experienced than average. We had much more experience than the average people. And operated. Last week I did one child, few days old, right? It was an oxygen he needed, because the left side, the lung was collapsed, and the whole intestine, everything of that. From my point of view, it may be simple. From other point of normal people, what they call on a grassroots, they see, oh, they will make a big mountain out of a small mole. All right, this is what it is.
Dr. Solanke, it's been a pleasure, absolutely, to have you on the interview. Thank you very much for coming.
My pleasure to be here.
Thank you.
Okay.
This has been the interview with me, Malik Jones. My guest has been Dr. Kanti Solanke. He's a surgical consultant at the Royal Victoria Hospital. Join me, Malik Jones, next week for another edition of the interview. Good night.
الحمد لله رب العالمين وأشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن سيدنا وحبيبنا خاتم النبيين وإمام المرسلين صلى الله عليه وعلى آله وصحبه أجمعين بعد الله ميرلالو جبرلالو البداودا مبافلال يكبو GRTS جان الله تفسير القرآن بنداتو السلام عليكم ورحمة الله وبركاته مروتنا نكتك كو نالون لو كنت بلا آية تناني أنكلين سورة المائدة dami yalo man stalla be kumala al yahudol la man kuto dol la insha Allah ikata lamoy lati fan yakum o ka lamoy ke lamoy mo kotam lebu ke lamoy muhammad la sallallahu alayhi wa sallam o mum man kutlet mi yalon ko abe mo mote si haklo to wato fan yakum mo man nyanna lamoy la katu fan ya hanna man kuke haka sonda moti nyale wala yatinna ka lamoy o famu masiboleti